In today's class, we are going to be talking about 17 facts about the penis, and it's going to be very interesting. Good day, everyone. My name is Gwendolyn Hale. I'm a seasoned and certified medical microbiologist, and I'm popularly known as the medical professional with the difference because I bring you knowledge like no other. I bring you health knowledge to your doorstep, to the comfort of your living room. You'll be enlightened. If you're a returning subscriber, this is me saying thank you. And if you just stumbled on this video on this channel, don't forget to join the channel. Don't forget to join the family, turn on the notification bell and subscribe and be empowered as well. Let's go there. Welcome back. Into this class, I'm going to be teaching you 17 facts about the penis, and these are not very common facts, so you're going to learn a lot today. The first point on our list is that the penis is not a bone or a muscle. Unlike many people think around the world, they say a penis is a muscle. No, a penis is made up of nerves, it's made up of blood vessels, connective tissues and erectile tissue. So if you want to define a penis, it's good to say that a penis is made up of spongy tissues. And in this case, we're talking about connective tissues and erectile tissues. So that is very important. It's more spongy tissue-like than muscle because the penis doesn't have the characteristics of a muscle. If you say the penis is a muscle, it doesn't carry out the functions of a muscle, but it does have the functions of an erectile tissue and a connective tissue. So that is how you're going to define the penis, or that is how you're going to look at the structure of a penis. The second point is penile fracture. That is the fracture of the penis. And this mostly happens during sexual intercourse, mostly when the lady is on top and the man doesn't have full control, and he may have his penis break. And during that time, he may hear a slight sound or a slight sharp pain. During that time, he needs to run to the doctor because if it's not treated in time, he can end up having a permanent penis curvature or erectile dysfunction in the future, and this is going to be a serious problem for him. So whenever you have this strange sound, whenever you're having sexual intercourse, do run to your urologist and get it checked. Don't assume everything is okay, because as time goes on, you will notice that your penis will begin to change color, and if it's not handled in time, you may go into surgery, and the truth is you may lose the permanent function of the penis, and the structure may be permanently damaged. You find it very difficult having an erection, and also you always have pain during sex. That is, the pain will be so unbearable. If your partner doesn't know how to be on top and is not very cautious, it is very, very important that you be on top instead, to control movement and also to preserve the health of your penis. Now, strangulation, or when the penis gets strangled, maybe through a thread or a hair. Look at it like people putting on a wedding ring. When you put on a wedding ring that is a little bit tight, you notice that after some time it changes color, and if care is not taken, that finger may be cut off. This also happens with the penis. If any object or thread or hair or any form of tissue is tied mistakenly or knowingly around the penis, as time goes on, blood flow will decrease, and then it may lead to necrosis or gangrene. And then that person may lose the penis. And this is a call for concern. Mothers need to be very careful when they are actually changing the diapers of their babies or washing their babies, to make sure that no hair is being tied around the baby's penis, or maybe no thread from clothing is tied around the the child's penis. This is also for little boys, and this is why I've stressed so much on these videos, that on my videos, that parents, particularly fathers, should be very conscious about teaching a child how to preserve their fertility from a young age. So when this thread or these objects, this hair or anything is strangled, you realize that when this gangrene or necrosis begins to happen, the penis will change color, and with long time it will lose sensation and it will need to be cut off. So penis strangulation is very, very common. Many people think it's not common. What about guys who are drunk? What about guys who are drunk and let me say they go to pee and they have thread from some of their clothing go around their penis and they fall asleep by the roadside or on their bed when they come back home or in the club, and as time goes by, necrosis happen or gangrene may happen, and what do you see? So these are things we need to avoid. The fourth point is penile amputation. Penile amputation occurs in a lot of societies, and especially in Cameroon where I am, when a lady finds out that you cheat on her, she takes a knife and cuts your penis. Now, that person who does that kind of act is supposed to be in jail. That is a barbaric attitude, and it should not be condoned. But what should you do if you find out that your penis has been amputated? You have to take the other half that has been amputated and put it on ice. Put it in a bag, a plastic bag, and place it on ice, cover it with ice, and rush to the hospital. If you don't have ice, make sure you are in a hospital within 6 hours so that it can be reconstructed. If you have ice, even better. Make sure you put the cut off penis in a plastic bag, you put it on ice, and you run to the hospital with it. It can still be reconstructed. Remember, it is tissue, so it's possible. The blood vessels will have to be connected, the nerves will have to be connected, the connective tissue and the erectile tissue will have to be connected. And this should be done by good specialized urologist. So what should you do to the other half of the penis that is on your body? You have to take a cloth in order to reduce bleeding, because the blood vessels are open and so blood will be gushing out and you don't want to lose a lot of blood. What you have to do is you need to take a tissue. I did a video on how to stop bleeding in a wound, and I think that you should look at it because it's very informative. Now you take a cloth and you tie it around the tip, not very close to the tip, but close to a little bit in the middle, to prevent blood from gushing out and you losing a lot of blood in the long run and maybe even losing your life. So you tie it and then you find your way to a good urologist and then you get your surgery done. I'm telling you, it is possible to reconstruct your penis back, but a lot of people don't know that. A lot of people don't know that it is possible, and this is very, very complicated, especially with the healing. If a man does not go back for the penis to be reconstructed, he may have a lot of problems with sensation, enjoying sex. In fact, his sexual life will be damaged. In fact, erection will be damaged. And if he's prone to keloids, it may even be worse. It may actually close the opening of the urethra. So this is a very sensitive topic, guys, and I think you should take it seriously. And if you have anybody or you know anybody whose penis gets chopped off, tell the person that I said so. Hook up yourself with a good urologist, a good surgical hospital who can actually reconstruct your penis back. Make sure you get some ice, put it on in a plastic bag, put it on ice, you rush to the hospital. If you cannot get ice at the moment, be in the hospital within 6 hours, and that procedure must have been done within 6 hours. The fifth point is skin loss of the penis. In some cases, some people lose some skin on their penis. maybe through their zippers, maybe through a bite, let me say children from a dog, let me say through an injury or a sport or an activity. Please do run to the doctors to find out that everything is okay and it heals properly, to make sure that no blood vessel is being tampered with, your erection is not going to be tampered with. Let's say even your urinary tract has not been tampered with. So it's going to be handled depending on the area where skin has been taken out from. If it's the gland, then the doctors will know what to do. But don't think you can put betadine on it or iodine on it or hydrogen peroxide on it and take care of it, put gauze on it, and everything will be okay. You need to make sure that a specialist looks at it. The set point is the size of an average man's penis. The average size of an erect penis is 6 inches. That's the average size. And there are some people who have longer, there are some people who have shorter. And I'll always say this on my videos, your penis size is specific to you, your DNA, and your race. It has nothing to do with what you eat. It has to do with your DNA and from your ethnicity, your race, where you are from. It has been said, commonly said, that most people from the black race have longer penises, and those from other races, let me say Asia, from other countries like Asia, ethnicities like Asia and the rest, have shorter. But I beg to disagree, because in every community you find exceptions, and just know that whatever you have is what you should work with. And please save your kidney the damage. Save your kidney the problems of filtering all sorts of concoctions or tablets you have taken in order to increase the size of your penis. That doesn't work. That doesn't work. And this leads us to the next point. Your penis stops growing at the age of 21. Please, don't think too much that at 25 your penis will be growing. At the age of 21, what you see is what you have. So learn to move around with what you have. With your partner, try to get the best position, and you will enjoy sex. Communicate more. Communicate more. And if you have a lady who has actually told you that your penis size is very small, don't get offended, don't get pulled down, don't let that bring down your self-esteem. You are created for someone. There's someone out there that has been created for you. Your first erection happened when you were in your mother's womb. Unlike what other people think, that your first erection happened most probably when they were younger, when they were little boys. Your first erection happened in your mother's womb. And this is what a lot of medical professionals say, or radiologists say, because during scans, and they are able to see the penis so erect. And if the penis was not erect, they won't be able to see it, because remember, in the mother's womb, the penis is so tiny and it needs to be erect for it to be picked up by a scan. The 9th point is morning erections are normal. If you don't get morning erections 1 or 2 times in a week, it's okay. But if after like 3 weeks you don't get any morning erections, it's a call for concern. Run to your doctor. When you are stressed, or when you have a little bit of challenge, or you're on some medications, or you're ill, you may not have a morning erection. But if you're okay, you're healthy, your well-being is good, your mental health is good, and you're not having a morning erection, it's a call for concern. Morning erections are very good because they actually reduce your chances of erectile dysfunction and even prostate cancer in the long run. So do make sure that you have good morning erections. And this is what you should have in mind as a male. And teach this to your teenage boys. Let's stop keeping away sexual education or sex education from our kids who are teenagers. They need to know this so they know how to preserve their fertility. It's not when they are old and they start hearing things from their peers and they get misinformed. We should be the first people, we parents should be the first people to educate our kids on their sexual health or reproductive health. Your last erection occurs at death. When you die, there is this rush that happens, and you have your last erection when you die. An erected penis can take several directions. That is important because there is this myth that says that an erected penis should only look forward. Some erectile penises look left, right, downwards, and upwards. And this will depend a lot on how the male has been packing himself while he was growing up. The angle which you choose to pack your penis is where it will tilt towards as you grow up as a male. So bear in mind that you should learn how to pack yourself. And this is a very important point. Many parents haven't taught their male sons how to pack themselves in the right underwear. Get yourself the right underwear and pack yourself properly. The spinal cord or the central nervous system is responsible for ejaculation. Unlike what most people think, that is your brain that is responsible for ejaculation, it is actually your central nervous system. It actually leaves from the spinal cord to the brain, then ejaculation happens. There are a lot of activities that happen, but the central nervous system is actually responsible for ejaculation. The size of a flaccid penis or a non-erected penis is normally shorter than an erected penis. So what you see when you are not erect is different from what you see when you are erect. So that is why penile length is measured on an erect penis, not on a flaccid or non-erected penis. The 14th point is your shoe size does not determine your penis size. Trust me, a lot of people have got this all wrong. There are people with large feet who have 4-inch erected penis. But there are researchers that have said you can easily know the length of a man's penis as per his height, like your index finger. So let's say if a man is this tall, his penis size will be like this. And if he's this tall, his penis size will be like this. I don't know how far that is true, but that's what some researchers have said. But you find that out for yourself. Uncircumcised penises, if you have an uncircumcised penis, you are more likely to have smegma. Smegma is this whitish, cheesy substance that is found underneath the foreskin. And if it is not washed out properly, if proper hygiene is not carried out on a daily basis, this may lead to balanitis. Balanitis, where the tip of the penis, the gland, is irritated, inflamed, itchy, and reddish in color. And if it is not treated in time, it may actually lead to phimosis. Phimosis is when the foreskin is stuck on the gland, on the tip of the penis, and can't pull back. It cannot retract back. And this can lead to penile cancer. And with penile cancer, you may end up losing your penis. This is for real, guys. This is for real. So please, if you are uncircumcised, you should be more hygienic than a man that is uncircumcised. You should actually wash yourself after every sexual, in short, before and after every sexual activity, and morning and evening. And this is very important. This will keep you from having balanitis or accumulation of smegma or any form of odor that may arise from that area. Circumcision does not change sensitivity. Whether you are circumcised or uncircumcised, you are still going to be sensitive at the tip of your penis or during sexual intercourse with your partner or sexual pleasure with your partner. But I did a video on uncircumcised penis, and I think you should watch it because it's in a lot of details. If your circumcision is wrongly done, the scarring, may actually make sexual intercourse unpleasurable for your partner and for you. So sometimes circumcision is not done properly and could leave from foreskin hanging out from some. Please, if there's a way you can fix this even as an adult, please do fix it. Both penises, uncircumcised and uncircumcised, do enjoy sensitivity. But statistics have shown that men who are uncircumcised, because the tip of their penis, their gland is not exposed, they are not exposed to a lot of stimulus as a man who is circumcised, whose gland is exposed. Circumcision does not reduce sensitivity in any way. And the last point is smoking and drinking reduces fertility. I've done a video on how to preserve a man's fertility, and I think that you all should look at it. Very informative. So excess smoking, excess drinking, especially smoking, reduces the balls, reduces your testosterone, your level of testosterone. And when your level of testosterone is reduced, your balls shrink. And there are some researchers or scientists that have also said that excessive drinking and smoking can actually cause your penis to reduce in size. Now, I don't know how far that is true, but if you know somebody who drinks a lot, do ask them if they have experienced any shrinkage in their penile length. Thank you for joining me in today's class. I remain your seasoned and certified